I wanted to do this video. I wish when I first began practicing as a nurse practitioner, I wish someone had done this video for me, or for, for the group of people that graduated when I did. I graduated in May of 2014. I'm a family nurse practitioner, and I wanted to do a really cute little video to show you guys what I have in my bag. What is in a nurse practitioner's bag? Sometimes on YouTube they do videos, what's in my purse, so I thought it would be really cool to show you guys what's in my bag. So, and my bag is really heavy. It's really, yeah, it's pretty bad, but I take this to work with me whenever I go. So I'm just gonna show you guys my bag. Okay, and I don't know if the camera really shows how big this bag is, but at this point in my career, I would feel incomplete if I didn't take the items that, I can't talk. If I didn't take the items I have in my bag with me, I don't know, I might freak out a little bit. So first up in my bag is my #1 item that I can't live without. If I was going to be late for work and I didn't have this, I would go back home and get it and I would just be late. And that is my iPhone. My apps are on here and I need it and I love it, and I'll have to do another video to tell you guys what apps I use that I can't live without, but this is #1. #2 is my other iPhone. This one is basically, I use iBooks on here, and I have, like, because I work for a federally qualified health center, I have the formularies for like Medicare, Medicaid, and all of that stuff, AmeriHealth, Trusted. I have all of that stuff on my other iPhone. I just didn't want to use up space on my main iPhone with those formularies. And I'll go in the order of the books that I really love the most, the things that I use the most. This book, Pediatric Primary Care Practice Guidelines, is so awesome. It just has everything in here for pediatrics and what you should use. I love that it has differentials. It has differentials in here. Sometimes when I'm doing my physicals, if I need to look something up, it's here. Like, for example, growth and development for a 4-month-old, how much they should be drinking, how much weight they should be gaining, how fast they would be growing on average every month. It's a really good book, 2nd edition, Beth Richardson. We actually used this in class the last semester, and I loved it so much that I take it with me to work every day. Next is going to be Differential Diagnosis and Common Complaints. The author is Robert Seller and Andrew Simmons. Now, if I'm honest, I don't use this much. I will use it mainly when I have someone with musculoskeletal issues. I really like it because I like the differential diagnosis. It kind of explains everything. So like lower extremity pain in adults, and then it'll list the cause, the nature, associated symptoms. I love that it'll list associated symptoms, aggravating factors that the patient may complain of, what you should find, your physical findings. So it kind of helps you when you get someone that has those musculoskeletal issues and you're just kind of like, who, I don't know. And I really do love this book. I just don't use it a lot because it's really wordy. But what I also love, because I do read it at home, like for example, it has some of the main things that you encounter in practice. So like headache. Everything you could want to know on a headache is here, and all of the differentials, why you would pick this diagnosis over this one. So it's really an awesome book, and yeah, it's one of my staples. I love this book. I read it more at home than I do at work. Now, this book is my favorite in the whole world, and you can tell because of how it looks. I bought this book brand new the last 2 semesters of NP school, and it's called Soap for Family Medicine. The author Daniel Maldonado, Cynthia Zuniga, and Peter Uzelak. Okay, this book is so awesome because not only does it tell you, let me turn to something. Not only does it tell you, it just goes SOAP, you know, SOAP. It tells you what you should, differentials. It tells you what you should find on your physical assessment. It tells you how you should treat things, and like everything's in here. I mean, look at this. You've got all of the medicine, you know, you've got allergic rhinitis, all of the, you know, most popular stuff that you encounter: fibromyalgia, dizziness, diabetes, delirium, constipation, all that stuff. And when you turn to it, it actually tells you, you know, for your subjective, objective, for your assessment, and for your plan, how it should go, even down to what labs you should be using. So this is awesome. Now this one I'll probably take with me for years. I love it. I love it so much. And then next, I work in family practice, so I also have Obstetrics and Gynecology because we do get some pregnant girls that come in. But we, you know, they usually come through walk-in for something, and I might have to glance at this book for something. And then my pediatric one, I do use the pediatric one. I love the format of these books. I don't use them as much as I use the family medicine one, but nevertheless, yeah, I take all 3 of them with me. 3 more books. Yeah, I take all of these with me. Next is my skin disease diagnosis and treatment book. This book, as a new NP, I have to have pictures, and this is my derm book, and I love it, and I use it often. This one I use all the time, and the diagnosis is the author Thomas Habif. I love this book. This was one of my best purchases. Next, I don't have to go over this too much. It's just basically my Sanford guide, antibiotics, information. Now, this book, I found this on my own, and I love it. I found that when I get crazy labs back, sometimes I'm thinking, what am I gonna do with this lab? This book has been a lifesaver. Clinician's Guide to Laboratory Medicine, and the author is Samir Desa. Basically, whenever you get a lab back, if you kind of don't know what to do with it or you want more information, it's full of algorithms. So here you've got macrocytic anemia. You know, what's the first thing I do for macrocytic anemia? And it tells you, you know, check the serum folate B12. And then after you get those results back, you're going to go this way or you're going to go this way. And you just keep... I love this. This is my favorite book, and it's just saved my life. I had a patient with an elevated AST, and yeah, this book saved my life. I love it. That one is probably my favorite. I have a lot of favorites, obviously. We're almost done. Next, I've got, this is my lifesaver here. You know, as family NPs, family practice, you do quite a bit of referrals, you know, so all of my insurances, where they can go as far as their insurance. And then inside, I don't remember where I got this from, but this Radiology CPT code easy guide is so awesome because when I need someone to have a chest x-ray or an EKG or a mammogram or an x-ray of their bones or anything like that, all of the CPT codes are here, and I love it, and I can't remember where I got it from. And then I also I made this up. It basically has my favorite things, my favorite papers. Like for pediatrics, it has all of some dosage and calculation stuff for peds, asthma information that I use, diabetic information, algorithms that I love, cholesterol guidelines, the ATP3 guidelines at a glance, the quick desk reference. I love this. It really is awesome. And then hypertension, some information on hypertension so I pretty much downloaded this stuff and I use it all the time. And it's in my binder. And also, my immunization records and my immunization guidelines are here too. I use those a lot. And my depot calendar. So everything I need as far as my personal stuff that I've downloaded that really helps me, I really use this. I would go home for this too. Next, I bought this at Target. And inside, I'm really a stickler for education. I have created pockets with stuff that I like to give my patients that are diabetics and that have hypertension, pamphlets that I've downloaded from online. Also like a blood glucose journal. When they come to see me so that we can do diabetes management, I like to have either the glucometer with the numbers or bring me your log. That's super important to me. And the same thing for hypertension. I have a log for my hypertensive patients too. Yeah. So this is just basically full of stuff copies that I give my patients as far as diet and that type of information. The last thing I've got is this little black book that's basically information that I got when I was in orientation. And I don't use it that much. I really haven't opened it in like a month. But it's just information I got in my orientation that I didn't want to forget. And this helps me with CPT guidelines. So that's what I have. My bag is pretty heavy. And everything that I have in there, I've spent some time trying to take out some books that I don't really use, but really at this point everything that's in my bag I pretty much use it, some more than others, but I love my books. They're awesome and they bail me out when I need more information. And maybe I'll do a video in the future about the apps that I have on my phone that also I love a lot. So that's it. I hope you guys enjoyed and have a good day.